Hi everyone, it's Dr. Derek here and welcome back to the channel. After my recent video on pancreatic cancer, I've been overwhelmed by the incredible response from so many of you. I've read all your comments, your personal stories, your heartbreaking losses and your frustrations with how late pancreatic cancer is usually caught by your doctors. One thing that really stood out was how many of you said you'd wish you'd known the early symptoms, the ones that happen long before jaundice or pain becomes severe. But before we jump into the symptoms, I want to very quickly explain why pancreatic cancer is so hard to detect early. The first challenge is the location of the pancreas. You see, it sits deep inside your abdomen, tucked behind the stomach and intestines, meaning that any tumors can grow for quite a while before they cause any noticeable symptoms. There are no lumps you can feel, and by the time it's big enough to press on nearby organs, it's often already advanced. The second challenge is that early symptoms are vague. These are all things that could easily be put down to stress, diet, or just getting older. You see, there's nothing specific or unique about them, and that's exactly why they get missed. And third, there's just no simple screening test for pancreatic cancer. We don't yet have an easy blood test like we do for diabetes, or a regular screening program like we do for bowel cancer screening. By the time that symptoms become obvious enough to trigger scans or investigations, the cancer is often quite advanced. So here are some subtle early symptoms to watch out for. Firstly, an unexplained weight loss. You see, we all lose a bit of weight here and there, especially if we've been stressed, eating less, or exercising more. But losing a significant amount of weight, about 5 to 10 kilograms or more, when you haven't changed your diet or lifestyle, is a red flag. For pancreatic cancer, this often happens because the tumor interferes with the pancreas's ability to produce the enzymes that help you to digest food. Even though you're eating normally, your body isn't absorbing nutrients properly. This type of weight loss is often accompanied by weakness and fatigue because your body is literally running out of fuel. Another symptom to be aware of is mild upper abdominal discomfort. See, this isn't the sharp, stabbing pain you might associate with something like appendicitis. It's more of a dull ache, a feeling of fullness, tightness, or pressure high up in the abdomen, just below your ribs. Some people describe it as feeling like you've eaten too much, even when they haven't. Others say it's a persistent nagging sensation that comes and goes. Because the pancreas sits so deep in your abdomen, tumors grow in there, press on nearby organs, nerves, and tissues. This causes this vague discomfort. Our next symptom to be aware of is back pain, especially in the middle back. This is one of the more surprising symptoms because most of us associate back pain with bad posture, muscle strain, or an injury. But pancreatic cancer, particularly tumors in the body or tail of the pancreas, can press on nerves in your spine, causing a deep, dull pain right in the middle of your back. It's the kind of pain that isn't relieved by changing position, stretching, or rest. It's just there. Many people, especially those who don't have a history of back problems, mention this symptom after their diagnosis, but it's rarely recognized as a warning sign early on. Our next symptom to be aware of are changes in the stool, particularly if they're greasy or pale stools. You see, your pancreas produces enzymes that break down fats, proteins, and carbohydrates in your food. When the pancreas is compromised either by cancer or chronic inflammation, you can't properly digest fat. The result is something we call steatorrhea. This is a fancy term for fatty stools. These poos tend to be pale, greasy, float in the toilet bowl, and may be difficult to flush. They can also have a particularly foul smell. If you notice this regularly, especially if you also have weight loss or abdominal discomfort, it's worth raising this with your doctor. Next up, and something to be aware of, is a loss of appetite or feeling full rather quickly. If you sit down for a meal and feel uncomfortably full after just a few bites, even if you were hungry before, it could be a sign that a tumor is putting pressure on your stomach or intestines. This early satiety, combined with unintentional weight loss, is common in cancers that affect the digestive organs, including the pancreas, stomach, and the liver. You might also feel bloated or slightly nauseated after eating even small meals, which can also further reduce your appetite. You may also develop new digestive issues such as bloating, heartburn, indigestion. You see, pancreatic cancer can disrupt your entire digestive process, partly due to the lack of digestive enzymes, and also partly due because the tumor itself may be physically blocking part of your digestive tract. Many patients recall new or worsened acid reflux, heartburn, and indigestion in the months before they got diagnosed with pancreatic cancer. If you suddenly find yourself reaching for antacids regularly, especially if it's combined with any of the other symptoms that I explained before, make sure that you speak to your doctor about further investigating things. Up next, and something to be aware of, are new diagnoses of diabetes in people without risk factors. You see, this is one of the most important but least known early signs. The pancreas not only helps with digestion, it also produces insulin, which regulates your blood sugar. When pancreatic cancer interferes with this process, people can suddenly develop diabetes even if they have no risk factors like obesity or a family history. So, if you're slim, eat well, and suddenly find yourself with a diabetes diagnosis out of the blue, especially after the age of 50, it's worth asking your doctor to check your pancreas. In fact, studies show that around 1 in 4 people diagnosed with pancreatic cancer were diagnosed with diabetes within the previous year. Pancreatic cancer has one of the lowest survival rates of all cancers, partly because it's so hard to catch early. Around 80 to 85% of people are only diagnosed once the cancer has already spread, when treatment options are limited. So, if you've been told that pancreatic cancer is a death sentence, you're not alone in feeling that way, but it doesn't have to be. We've made huge progress with early detection techniques, new treatments, and surgical options like the Whipple procedure. When caught early, can dramatically improve survival rates. Raising awareness of these subtle early symptoms can help to change the story for more families. If you found this video helpful, please leave a like and subscribe. And remember, I truly care about your health and I wish you the very best.